it's Chelsea. Today this video is for the IV insertion and also discontinuing the IV catheter. So I have all my supplies here and I'll go through that. So first thing I'm going to do is come in, make sure that I'm maintaining privacy for the patient, perform hand hygiene, and then I am going to get my gloves on here. Explain to the patient that we will be doing an IV today. So that does require a needle stick, so it'll be a quick poke. And we are doing this today for IV fluids. So I have a 22 gauge here. And then the first thing I am going to do is I'm gonna prime my saline. We wanna make sure there's no bubbles in there and push air inside the patient's vein. So we're gonna go ahead and do that first. Make sure this is unlocked. And it is. So I'm just gonna go ahead and push through. There it goes, perfect. All right. Just gonna lock it there. And I'm gonna put the cap back on. Normally we would have a sterile cap that we can go ahead and put back on, but I'm just gonna use the one that we have here. So that's all prepared and ready to go. And then just gonna feel here first for the vein, just to kind of get an idea of where I would like to go. And then I'm gonna apply my tourniquet about 4 to 6 inches above my IV insertion site here, and I want to make sure that this is not too tight for the patient. I'll be using an alcohol swab today, so I'm going to go ahead and wipe in a circular motion, and I'm going to start from inner and then go out. Right. So while that's drying, I'm going to go ahead and grab my needle and catheter here. That looks just about ready. So now that it's dry, I want to insert about 1 to 2 inches distal. Hold the skin taut here. I'm just going to go ahead and insert till I see that flashback, which I do. I see the blood filling in the hub, so I'm gonna start advancing the catheter about 1/4 of an inch in till it's all the way in. Beautiful. Retract it. I'm gonna occlude the vein here and release the tourniquet. Then I'm gonna attach the extension set here. Awesome. And then what I'm gonna do is I'm gonna unclamp it now, and I'm gonna aspirate to check again and ensure that we're in the vein and I'm getting that blood return. So I'm gonna go ahead and push and flush the IV. Ask the patient, are you feeling any pain, resistance? Making sure that there's no stinging or burning. All right, perfect. So now I'm gonna go ahead and lock this. And I have my dressing here. So what I'm gonna do is I'm gonna go ahead and peel this. And we have to make sure that our initials, the time, the date, and the gauge that I use is on here. I'm just gonna apply it right there and then ensure that I peel off this part. Stick that on there. Then I'm going to gonna discard the flush. And then that tape that I prepared already, just keep it like this in a loop and tape it. If this was on an arm, I wouldn't put it above, I would put it down here, but just to show that I'm taping it, and it would look like that, but this would come down lower. And then I would document all this information. Again, pretty much what I put on the dressing, I would notate that in my documentation, how the patient tolerated it, if there was anything that went wrong or if there were any complaints from the patient, I would mention that as well. And then now I'm going to move on to discontinuing. Move this stuff out of the way. So I have my 2 gauze here. So for discontinuation of the IV, I would come back in, maintain privacy for the patient, do my 2 patient identifiers, perform hand hygiene again, and then put my gloves on and make sure that it's still clamped, which it is. We just don't want any blood leaking anywhere. So I'm going to remove that tape. And I'm going to remove the dressing here. And I'm still stabilizing that vein. And I'm going to put that new gauze as I get ready to, right above here, as I get ready to remove the catheter here. So I'm going to slowly but in a timely manner pull the catheter out here and let the patient know that we're removing the catheter. So 1, 2, 3, perfect. I'm going to hold this for 30 seconds while I'm putting pressure here and occluding the vein. I'm just going to check the integrity here of the catheter, make sure that it's still intact. We don't want any pieces stuck inside, but everything looks good here. So I'm going to go ahead and toss that in my sharps. Remove the gauze, toss that, apply my gauze here, folded, and I'm going to put the tape over. And that's it. I'm going to remove my gloves, perform hand hygiene, and then again, I would document everything that I did for the discontinuation of the IV. I would note if there was a piece missing on the catheter. I would note if there were any abnormalities or if something went wrong. If the patient had phlebitis or something, I would notate that. Just ensuring that there was pretty much anything that I've done with the patient, I would document that. The time, whatever I noticed, if there were any significant findings, and that's it.